Hello and welcome back to another Healthcare Innovation Quick Chat video. I'm Matt Rayner, publisher at Healthcare Innovation. I'm thrilled to be joined alongside Alan Frankel, Executive Principal at Vizient. Alan, I've got a number of questions I'd love to ask you today. I think where I'll start is why don't you take a brief minute to tell us about yourself and why this mission of working with healthcare organizations to build healthy cultures is so important to you.
Sure, delighted to. So I'm an anesthesiologist by background. Started my career in Boston and very quickly discovered just how wonderful medicine is, but also how risky. But I got launched out of anesthesia into the world of safety and reliability in 1997. I was in a hospital that was delivering 6,000 babies a year. 2 of the moms died immediately after childbirth in the space of a week. And I landed up responsible for understanding and analyzing why those deaths occurred. Changed my career. So since the mid-90s until we're talking here today, my interest has been how do we create an environment where patients get the safest care, and how do we create an environment where the people delivering that care are able to do so in a way that enhances their lives, gives them joy in work.
Absolutely. So let's begin by talking about the importance of visual management boards. Can you describe what this technology is and provide some insights to our audience into how it's being used throughout a healthcare organization?
Sure, happy to. For literally the last 25 years, we've been going into organizations and being asked to run interventions to help them be safer, to make teamwork better, to make them more reliable. And it's always been challenging when we've gone in to create the culture and the work processes to help make healthcare safer and to make those individuals better able to deliver that care. And then you come back and look a couple years later, and a lot of the work's dissipated. It just doesn't last. So we started asking ourselves, there's got to be some kind of skeletal architecture that we can put into the healthcare systems, into the hospitals, that will help us support our work and make it more sustainable. That's how we came up with the digital learning boards. So I'm sure the audience knows almost every clinical area you go into is going to have whiteboards with quality data on it. What we re-envisioned those so that they are essentially a communication hub, a mechanism to help managers more effectively work, a mechanism for creating voice by frontline providers. You can turn those whiteboards into something that's powerful if you know what to do and you know how to think about it.
We know that healthcare organizations use data for strategic planning purposes, looking at clinical outcomes, benchmarking against other similar organizations, et cetera, right? Can you explain to our audience how we can look at analytics differently and what other opportunities can be identified using different types of data?
Sure. So I like to divide data into 3 buckets: clinical, operational, and cultural. I think that's the easiest way to think about it. If we're able to generate relationships between culture data, attitudes and perceptions, operational data, how does the work get done, and clinical data, which are the outcomes for patients, then all of a sudden it's like the Holy Grail. You say, how do I change the culture and how do I fix the operations to get the clinical outcomes that I want for patients? And in the process of doing it, not burn out my workers at the same time. So data's powerful, and Visiant, I'm delighted to say now that I've joined Vizient, we've got all 3 in our hands to be able to generate the relationships between them. It's pretty exciting.
That is exciting. Now, when you describe culture and engagement data, what tools are out there that can provide this intel, and how can this data help providers with their organizational operations and strategic planning?
In the early 90s, when all of a sudden we realized, wait a second, healthcare is error prone, the safety culture survey started coming in to measure what we called quote unquote safety culture, which isn't really safety culture at all, it's culture. It's perceptions of leadership, perceptions of safety, perceptions of teamwork. In parallel, The HR folks, human resources folks, were interested in employee satisfaction to employee engagement. Engagement is, how do I advance? How do I grow? Do I intend to stick around in this organization? What we have done is we've taken all of the domains in both sets of instruments, all right? Leadership, teamwork, safety, advancement, growth. We've combined them together to say they're just a measure of culture. And we've learned how to make them more specific and actionable, and we've put them together in an instrument that we call SCORE. We've given SCORE to about 20% of the healthcare workers in the US. Amounts to about 3 million respondents. In our benchmark, we've got around 250,000 respondents at any particular point in time. We have the largest benchmark database for physicians and nurses in the country. If you want to talk about data and being able to use it, we're sitting on a lot of information about the attitudes and perceptions of people in the workforce.
That's wonderful. So now we have this data, right, on culture and on engagement. We also have clinical outcomes data, which providers use for strategic planning purposes. Can the two data sets be used together?
I get to sit with the data analysts at Vizient and say, let's look at the burnout data we've got from our culture survey, let's look at the outcomes from the hospitals, and let's see if we can show a relationship. And the answer is we can. One of the things that we just recently measured in a group of hospitals where we've got both the clinical data and our culture data is what we call hospitalized standardized mortality rates. Patient comes in, they're really sick, you look at how ill they are, and you say, what do we expect this patient to live or die while they're in the hospital? Expected mortality rate. Then you can look at the observed mortality rate, how many of those patients actually die. If hospitals are working really well, fewer of those patients will die, and if hospitals aren't working real well, more of them will die. We can show a relationship between our burnout data and those mortality rates. As burnout goes up, the mortality rates get worse. So that means that an organization can look at how many patients are dying in their hands and then look back at their workforce and say, how burnt out is my workforce? And go, all right, I need to fix the workforce if I want to give better care to my patients. We can actually measure it. It's pretty cool.
That is cool. Can you share with us how this all comes together to help providers on their journey to high reliability?
Almost every organization in the US and elsewhere is kind of talking about high reliability. You go, well, what does it mean? High reliability is a cultural phenomenon on which you build technical expertise. The organizations don't quite get this. They all go to the technical. How are we going to put improvement into our hospital to drive safety and reliability? It's a wrong question. How are we going to create the culture on which improvement works to get high reliability? So what we have in the Visiant structure now is with experience, we know how to go in and train entire healthcare systems. Start with the executive leadership, then you move to kind of the two levels of middle management, the senior managers or directors and the frontline managers, and then you go and look at the people working at the front line doing the work. All of them have to think about high reliability concepts similarly. The leaders have to be able to walk the talk. They have to be able to come down and have conversations with people at the front line about the topics of importance. The managers have to be able to run their units in a systematic way that the organization supports. So we've got digital learning boards that support the managers to run huddles and to gain information. Those digital learning boards give the front line the voice that they need for their concerns or for their issues to go into some place where they don't go away. Leadership can come and round because we can train them on the rounding process. When they come down to round, they're looking at these digital learning boards that have the appropriate data on them, and all of a sudden we have created the skeletal architecture to actually run a high reliability organization.
So everything that you have mentioned to us today is included in Vizient's comprehensive high reliability organization offering. Tell us a little bit more about this offering.
Sure. Well, as I said, organizations are coming to us with a desire to achieve high reliability transformation. So what we say to them is, look, let's look at your base function right now. You can do the SCORE survey. It covers all of safety, culture, and engagement. We can say, here's what your baseline level looks like. If you're an organization that's in Vizient and in the clinical database or the operational database, which is our workforce evaluation, or an outpatient unit that is feeding information into Vizient, we can look at your outcome data and your cultural data and say, here's your current state. And we can go, all right, this is your current state, where do you want to get to? We have the ability to say, we can sequentially, let's train your leadership and create your educational structure to train middle management frontline. Now let's go in and in a cohorted fashion, put the digital learning boards into your service lines or your organizations, and then let's create concurrently create a sustainable structure to make sure that lasts for a long period of time. So you're correct, soup to nuts. We can go in and change an organization.
Right. And then my final question, Alan, what types of healthcare organizations can benefit from this offering?
The bottom line is, if you're in the business of healthcare, inpatient, outpatient, we're in a position to be helpful to you in advancing your work.
Excellent. Thank you, Alan. Thank you to our friends at Vizient for partnering with us on this quick chat video, and thank you to you, our healthcare innovation audience. Until next time, take care.